Hello, welcome to my YouTube channel. It is Dr. Nonny, your favorite OBGYN specialist next door, who is here to educate and empower you in all aspects of your health as a woman. For those who have subscribed to my YouTube channel, thank you for doing so. For those who have not subscribed, please subscribe to my YouTube channel. Link in my bio if you're watching it from Instagram. Click and turn on the notification button so that you could be the first to get updates about your health matters. Now, today, this video series is for 5 safety checks for women who have had a previous cesarean section and they are requesting for a vaginal delivery. Now, I'm going to explain to you the 5 safety checks you have to look out for and why you should look out for that. Now, this is going to help you to reduce the risk and the complications of trying to have a vaginal birth after a cesarean section. Vaginal birth after cesarean section is what we call Vbac, and trying that is what we call TOLAC. TOLAC is trial of labor after a cesarean section. Now, if it is done in a right institution where things are properly done all through your pregnancy, labor, and delivery, it could be fantastic. Now, because in 70 to 75% of cases, if things are done in the right way, it could be successful, but then it can be too risky. Now, I'm going to explain to you why. Now, if this is the womb, okay, usually when we want to carry out a surgery, we could have different types of incisions, a cut on the womb. So we usually cut around here. We call here a lower uterine segment. We usually cut here to deliver the baby. Now, when we cut here, the womb opens up and we deliver the baby. Now, a cut could be given here as well, but usually, if you want to try a Vbac, it's usually a cut given around here. It's important that you know the risk. The major risk of attempting a vaginal birth after a cesarean section is that the place where you had a cut, in labor, it can tear apart. I'm going to explain to you why. I have to tell you about the 5 safety checks because of all of this risk. Now, when the womb tears apart, it can bleed torrentially. And if things are not done fast, a woman can die or she could require a lot of blood transfusion. We call it uterine rupture. Sometimes the womb has to be removed to salvage the woman from dying. And the woman can be admitted in the intensive care unit. It could be their complications. And most times when the womb ruptures and it is not even born early enough, the baby can also die. Because of course, when the baby is no longer in the womb and is cut short of the blood supply from the womb, baby would also die. So it is very important that you understand the safety checks so that you could have a reduction in all of this risk. Number 1, if you want to attempt a vaginal birth after a previous cesarean section, the delivery has to be planned in a consultant-led unit. I did not say midwife. I did not say any doctor. I said a consultant obstetrician. Now, I am a consultant, for instance. I spent over 7 years to have a training to take care of women, learn about surgery, learn about risk in managing disease conditions about women. So, as an expert, we know how to anticipate. We have a third eye to see and foresee and get forearmed as experts when it comes to these issues regarding women. Now, if you book in a place that is not supervised or manned by a consultant, you're likely going to have complications because things can go wrong. So that is why you have to request to be booked in a consultant-led unit, simply because the pregnancy is what we call a high-risk pregnancy that puts you and your baby at risk. Any woman who is pregnant should not die. I mean, it's like a vacation. Why should you die? So when you book in a consultant-led unit, now all hands would be on deck. Problems will be anticipated earlier from the experts, and things can be done accordingly, even if things like that happens, to reduce the risk. So that is it. Now, the important thing about the risk is because of you having complications like uterine rupture. So that is why you have to book in a consultant-led unit. Number 2, you need to understand the predictors of success. Now, if you do get into a spontaneous labor, I mean, the neck of the womb is already opening up, then you're less likely going to need a hot drip, which are medications that can be given to you to cause the womb to contract. You are more likely to have a successful vaginal birth after cesarean if you enter into a spontaneous labor. So when you pass 40 weeks and you're not in labor and your doctors are requesting for a repeat cesarean section, do not argue too much because that is the best for you. Putting up a hot drip to induce your labor or to stimulate your labor would increase the chances of the womb tearing apart when you're in labor. Remember, when you are in labor, you already have a cut on the womb. The womb begins to contract. When the womb contracts, we do want to ensure that you have a baby that is also an average weight. Maybe within 2.5 to 3.5 kg is preferable, because when you have a big baby, the muscles around the womb begins to contract to squeeze out the baby. If you have a scar at the lower part of your womb or anywhere in the womb, the scar tissue is not as flexible as the normal muscles around the womb. So with the contractions and the pressure, there is a high chance that if you have a big baby trying to contract to push out the big baby, that scar would likely tear apart. And then you're going to have a uterine rupture, which is a life-threatening condition. And that is why most of the times we do request for a scan before you fall into labor. So if you have a very big baby, we would not allow you to, try a vaginal birth after cesarean section. Another thing that can increase your success rate would be if you have had a previous vaginal delivery before you had a cesarean section. Now, your chance would increase to over 80% because you're likely to fall into labor, you're likely to have a successful vaginal delivery. Another thing is, if you had a cesarean section because of the labor had difficulties, probably prolonged. Now, one of the factors that allow your labor not to be prolonged is the pelvis. The pelvis is the basin around between your thighs where the baby's head comes out from. Now, if there are issues with the outlets, that's the basin, the pelvis where the baby comes down from, the size is a bit, smaller than the baby's head. You had that in your previous delivery for which you were planned for a cesarean section. If that is one of the reasons why you had a cesarean section, then it is likely that that pelvis will still be of the same size. So you would likely have a reduction in success of your cesarean section. So you should have that at the back of your mind so that when you are in labor and you have had such kind of experience and you are trying a vaginal birth after cesarean section, you would likely have a cesarean section again because the labor the second time may be prolonged. Now, these factors you should have at the back of your mind when you are planning or requesting for a vaginal birth after a cesarean section. Another safety point that you should tick good in a place you want to plan for a Vbac should be that there should be 24 hours provision for emergency cesarean section and blood transfusion. The reason is because of what I just explained. In labor, the womb can tear apart, you could bleed excessively. Let me tell you, 20% of the amount of blood pumps out from the heart gets into the womb during labor. So that means in labor, in 1 minute, about 500 to 700 ml of blood is being pumped into the womb in a minute. So you can imagine the womb tearing apart and the kind of blood loss. You could lose the whole of your heart in 10 minutes if you have a uterine rupture. So if a woman has a uterine rupture, the whole of the blood supply could be lost within 10 to 15 minutes if it is so bad. And so that is why it is very paramount for you to understand this fact, so that if you are in a hospital where this kind of thing happens and uterine rupture is anticipated, interventions will be put into place to salvage you by ensuring that you have facilities for emergency surgeries and blood transfusions. Otherwise, you don't have to book in a facility that does not have any of this. Fourthly, baby doctors have to be there, because one of the signs that there is a problem happening when you're in labor and your womb is giving way is that baby will not be happy. So you need baby doctors to be around to take care of your baby. The final safety check, which is very paramount when you are trying to attempt vaginal birth after a cesarean section, should be that it should be attempted in a facility where there is a CTG monitor. A CTG is a monitor with a strap attached to your tummy that monitors the baby's well-being and the contractions you're having when you are in labor. The importance of this is that the first sign of the womb giving way when you're in labor is detected from the baby's heartbeat. The baby's heartbeat will start dancing up and down, coming down, or going to up. Baby is going to show signs that he or she is not happy. Now, if you get to a hospital where they are using peanuts and listening every 15 minutes, that can be missed. So when you're in labor and you're going for a Vbac, you should request for a CTG. If there is no CTG that will be available in labor, please get to another center, because that is the earliest sign for any doctor or the midwife to detect that something is happening or going wrong, and it's from the CTG and from the baby telling the doctors, I am not happy. So when you look at the CTG monitor and you see that there are a lot of dips, or the baby's heart rate is high above 160 or low below 110, and your eyes is on the monitor, you need to call your doctors, you need to call your midwife. It means that the womb is likely to give way, or is about giving way, or has just given way. You don't have to wait until you have abdominal pain or bleeding. Before you begin to have all those symptoms, the womb had already given way, and you could have missed that because you were not monitored with a CTG. So that is called continuous electronic fetal monitoring. Now, if you put these 5 safety checks in your book and at the back of your mind, then you are likely to have a higher chance of having a vaginal birth after Caesarean-Section, a successful vaginal delivery, and less complications. I hope you learned something about safety checks for Vbac today. Please share, comment, like, tell me what you've learned today. Follow me for more tips. In my next video, I'm going to give you other tips you need to learn about vaginal birth after Caesarean-Section. For now, see you next time. Bye. Stay lovely and beautiful. Subscribe to my YouTube channel